The study surveyed 46 labs including 35 health center 3s, 2 health center 4s and 9 hospitals, focusing on adoption and effectiveness of the recommended biosafety practice guidelines at public health laboratories. The cross-sectional survey targeted lab technologists, assistants and other staff actively involved in lab operations, among others. In some cases, the issue was lack of supplies. In others, guidelines or poorly designed infrastructure made it difficult to respond effectively to emergencies.
A number of laboratories did not have what was necessary to handle the emergencies. For example, you're handling a sample and it falls out of your hands to the floor, and that blood or sample spills on the floor. When that happens, how do you clean up that spill without exposing yourself or other staff in the facility?
According to the researchers, in case of an emergency in the labs, there is need for the ability to quickly do first aid and limit exposure to other staff and surrounding environment, but some health center 3s had no first aid kits.
So what that means is that in case a staff got a cut while they were working, they will not be able to quickly address that cut. And yet in infection prevention and control, the quicker you perform first aid, the lesser the chances of the exposure resulting into actual infection.
This raises safety concerns as the staff can be exposed to risks.
For example, we know that COVID is spread through the air. Therefore, a sample collected from somebody with COVID, if you generated droplets from that sample, those droplets can infect any person who takes them in. Now, because in the laboratory you manipulate this sample, you handle this sample, you have to, depending on what it is you're going to test, you have chances of generating droplets. Therefore, the emergency facility or the infrastructure to support emergency care is very relevant and very key.
The Ministry of Health says it will review the findings to step up emergency preparedness.
As the Ministry of Health, we are going to make sure the findings are taken in good faith and also making sure we are improving our emergency preparedness and response. We have challenge with disposal of our waste, but currently we've developed a means of making sure our different facilities can dispose of waste, since we all know that from the previous communications in regards to the company that has been picking the waste as a kind of halted way pending the communication from the funder.
NOBERT ATUKUNDA, NTV News.